Hello everyone, today I'll be presenting my community health project focused on Rialto, California. Through a windshield survey, demographic data, health indicators, and community interviews, I identified obesity and diabetes prevention as the priority health need for this population. I'll also share a plan of care that highlights the role of nurses in addressing this issue. Rialto has a population of about 104,000 people, with a relatively young median age of 33 years. Nearly a third of the residents are children under the age of 18, and 13% are older adults over 65. The city has a diverse community with over half identifying as Hispanic or Latino. Families and cultural pride are major strengths, but Rialto faces significant challenges when it comes to chronic diseases, particularly obesity and diabetes. These conditions are impacting health across generations and have become a critical public health concern. During the windshield survey, I noticed many fast food restaurants concentrated along major streets, but very few grocery stores with affordable, fresh produce. Parks and sidewalks are limited, making physical activity less accessible in some neighborhoods. Housing appeared older in certain areas, and there was little infrastructure to support an active lifestyle, such as gyms or walking trails. These observations align with data that point toward unhealthy environments contributing to poor nutrition and physical inactivity. County-level health indicators reinforce these concerns. In San Bernardino County, the adult obesity rate is 36.3%, which is higher than the state average. Diabetes prevalence is 17%, which means that nearly 1 in 5 adults has the condition. Over 21% of residents report limited access to healthy foods, and about 25% are physically inactive. These statistics are concerning because obesity and diabetes not only reduce the quality of life, but also increase the risk of heart disease, kidney failure, and premature death. My first interview was with a local school teacher. She emphasized that many children she had come in contact with had poor eating habits and limited physical activity. She also noted an increase in childhood obesity and even prediabetes. A key gap that she identified was the lack of healthy food options in school lunches and the limited focus on health education. She suggested that schools partner with local health programs to integrate more nutrition and exercise initiatives. My second interview was done with a manager at a local grocery store. He described the community as hardworking and supportive, but pointed out that many families rely on fast food due to cost and convenience. He explained that affordable grocery stores are limited, and customers often complain about the difficulty of finding fresh produce. His recommendation was to expand farmers markets, mobile produce vendors, and incentives for small businesses to stock healthier options. This highlights how economic and environmental barriers affect our health. My final interview was with a school nurse. She confirmed that obesity and diabetes are among the most common health issues she sees in the students. She noted that while some diabetes education programs exist, they are not nearly enough to meet the need, and some do not target an age-appropriate audience. Many students she encounters delay care due to the lack of transportation or financial challenges in the family. Her suggestion was to implement more community-based prevention initiatives, such as culturally tailored nutrition workshops for the entire family and better access to screenings and education programs. From both the data and the interviews, obesity and diabetes clearly stand out as the priority health needs. These issues affect children, adults, older adults, creating a cycle of chronic disease that impacts families and puts a strain on local healthcare systems. Addressing obesity and diabetes is urgent because prevention can reduce healthcare costs, improve quality of life, and extend life expectancy for Rialto residents. My plan of care begins with an assessment that identifies obesity and diabetes as the top priority. The short-term goal is to increase access to healthy foods and nutritional education, while the long-term goal is to reduce obesity and diabetes rates by 5 to 10%. Recommended interventions include partnering with schools to provide nutrition and physical activity programs, expanding farmers markets and mobile produce vendors, and offering cultural relevant workshops on diabetes prevention and management. Evaluation would include tracking BMI screenings, diabetes incidence, and community participation in programs. Nurses play a critical role in this plan of care. They can lead community education sessions on nutrition and exercise, advocate for policy changes such as incentives for healthy food vendors, and collaborate with schools, churches, and local organizations. Nurses also serve as a liaison between residents and healthcare providers, helping connect individuals with screenings, resources, and support services. By combining clinical expertise with advocacy, nurses are in a unique position to address obesity and diabetes at the community level. In conclusion, obesity and diabetes are pressing health concerns in Rialto, driven by limited access to healthy foods, high reliance on fast food, and insufficient opportunities for physical activity. Both the community and healthcare professionals recognize these issues, and the proposed interventions provide a roadmap for prevention and long-term health improvement. With strong nursing leadership and community collaboration, Rialto can work toward reducing obesity and diabetes and building a healthier future for all its residents.